Mr. Larry.
Hello.
I'm Kathryn Black, and I'll be the nurse following your care here at the DHRA Post-Stroke Case Management Clinic. We appreciate your commitment to your health and well-being.
Thanks. Yeah, stroke was a wake-up call for me to manage my health and life better. Want to be around when my grandkids come.
You have taken the first step in changing your health. Here at the clinic, we will work with you to self-manage your risk factors and give you the tools to help modify an unhealthy lifestyle that can contribute to your risk for secondary stroke.
Sounds good.
So at this time, during the patient and provider interaction, I would do a general overall appearance of the patient. So this would include things like nutrition, cleanliness of the patient, attention to grooming. I'd also observe the patient's consciousness level, because I want to establish a baseline in case later on down the road there's a change in his level of consciousness. I also want to look at his posture, and if I noticed coming in, if there's any kind of fine motor or gait abnormalities that I would have noticed. So the first step here at the clinic will be to perform a comprehensive physical assessment. This will help me identify areas of deficits from the stroke and risk factors that may need close management or lifestyle modifications. I can also recommend referrals for other disciplines within the clinic that can help set you up for success in managing life after a stroke.
All right, that sounds good. I can definitely tell I'm not 100% back to normal, but I don't know how exactly these problems aren't resolving.
Well, in stroke patients, it's very important to first test the neurological system, since blood clots can travel to the brain, cutting off their blood supply, and this in turn can affect how the cranial nerves function. So testing the functions of our cranial nerves can identify stroke deficits and then provide me with information for your personalized care plan. I'm going to sit down here first. So can you tell me who you are?
Yes, I'm Brandon Leary.
And where are we right now?
We're at the stroke clinic.
And what is the day and year?
It is the 17th of February, 2018.
Very good. So I'm going to have you close your eyes and then just follow a couple simple commands. I want you to lift your right arm, lift your left arm, and lift both of your arms together. All right, then put them down, please. Now I'm going to ask you to name 3 objects. The first object.
Stapler.
Correct.
Pen.
Correct.
Scissors.
Very good. And I would do this asking him to name these objects because sometimes with stroke patients, they have nominal dysphagia where they're unable to identify objects or even people. I'm also going to ask you to repeat this sentence that I'm going to tell you. The sky is blue in Richmond.
The sky is blue in Richmond.
Okay. And just for the purposes of this assessment, he slurred his speech some. For the rest of my physical assessment on this stroke patient, he's just going to speak normally. But I did want to pick up that his speech is slurred when he does that statement. So next I'm going to test some cranial nerves. So I'm going to test the cranial nerve 5. And this is done by just taking a piece of tissue, cotton, just so the patient, you can feel the sensation on the patient's face. So I'll rub it over the patient's forehead. I'm going to do the sides of the cheek and on the jaw. And can you feel that?
Mm-hmm.
And he does. I'm also going to test the accessory nerve, and that's cranial nerve 11. I would just do that by asking the patient to raise his shoulders, so shrugging his shoulders up, and he is able to do that. I would look for any kind of asymmetry. This would tell me if there's any nerve deficits in that cranial nerve number 11. I'll test the facial symmetry of a stroke patient by asking him to smile, and he shows his teeth. Sometimes patients with stroke, they don't have that facial drooping, but once they smile, their face will droop to one side. I'm also going to inspect the patient's mouth and tongue. So what I would ask my patient to do is stick out his tongue And you can see it goes in the midline. It doesn't deviate to either side. So this tells me that cranial nerve number 12 is undamaged. Again, I'm going to also look for some swallow deficits in the patient. So one thing to do is check for the gag reflex. On this patient, I'm not going to actually test his gag reflex. But if it was absent, if I did test it, that would indicate damage to cranial nerves 9 and 10. I also want to test for dysphagia. So I'd ask the patient to take a sip of water. So I noticed that the patient is coughing, maybe looks like he's having some difficulty swallowing. So this would kind of tip me off that maybe we need to explore some swallow deficits more. He might need a swallow eval. I'm probably going to get into some questions about that a little later as well. I'm going to test the sense of smell, since this can be affected. The olfactory nerve can be affected in the stroke patient. So I'd ask them to cover one side, one nostril. I'd ask them to close. And I'd see if you could smell something strong. In this case, peppermint. It says yes. Check the other side. He says yes. Then I'm also going to check the optic and ocular motor nerves. So I'm going to do this by just using a pen in this instance. So checking the ocular motor nerves of the eye. So I'm going to bring this pen into your vision. You just let me know when you can see it. Okay? All right. He sees it in all his fields of vision. Also going to check the light reflexes. So if this was a true flashlight that I could shine in my patient's eyes, I would just click it on, make sure the pupils are reactive to light. And they are. And also looking for any kind of eyelid drooping that would observe damage to cranial nerve number 3. I'm also going to ask my patient if they have any ringing in their ears. Do you notice any ringing of your ears? Because this also can indicate damage to the auditory cranial nerve. I'm also going to ask for problems with hearing, such as doing the whisper test, where I just might come up to his ear and whisper something on each side, come over to the other side and whisper something in his left ear, making sure that he can hear what I'm whispering in each side. So moving on from the neurological assessment, I'm going to do the cardiovascular assessment. This is particularly important with stroke patients to make sure they don't have any irregular heartbeats, especially something as atrial fibrillation, because that certainly can increase patients' risk for strokes. So I'm just going to have him sit on the side or the end of the bed here. I'm going to listen to his heartbeat. I will listen for a full minute for the apical pulse to make sure there wasn't any irregularities, missed beats or anything like that. So again, I would do that for a full minute. I'm also going to check his pulses. I want to make sure that I don't have any irregularities in his pulses, and they're all strong as well. I would also come down to his feet. Can't see his feet right here, but I'm checking his pedal pulses. I'm also, at this point, I'm going to check his blood pressure. Just simulate this really quick. And so in this particular stroke patient, I did find that their blood pressure was 150/92. When I checked his pulse, it was 83. They were both strong, regular. His heart rate was regular. I didn't hear any irregularities in that. That would indicate to me that he was having some kind of arrhythmia that we further needed to explore. So then I'm also going to check, when I'm doing a cardiovascular assessment, any signs for edema, particularly in his lower extremities. That would indicate maybe congestive heart failure. Again, congestive heart failure shows us that the heart isn't at optimal capacity and functioning. So we want to make sure we're looking at, do we need to explore further tests for the heart that would put us at risk for stroke down the line. I also need to assess the pulmonary system. So one of the most important things with that, of course, is assessing my patient's lungs. I don't want to hear any wheezes or crackling. I'm going to make sure, because that way it could possibly indicate congestive heart failure, maybe even pneumonia. So I'm going to listen to his lungs on his back. I'll ask him to take a deep breath. Inhale and exhale. And one more time. Very good. I also have to check the front. And I would just go down his chest and listen to all 4 quadrants there. I want to check for perfusion, how his vascular system perfuses throughout his body. So I'm going to ask to check his capillary refill. So I'll need to see your hands. And here, I just check, press on the nail beds, check for perfusion. That should come back within less than 3 seconds. I shouldn't see any blue fingertips. They should be warm, dry. And probably check his oxygen saturation too, to make sure that, again, that oxygen is adequately perfusing throughout his body. His peripheral vascular system is functioning at optimal capacity. I would ask my patient about coughs. Because a cough in a stroke patient, if we're saying the cough is worse at night, does that indicate perhaps heart failure, as opposed to do we have a cough after we eat solids or liquids? So I'd ask my patient, do you have a cough that is associated with food intake?
Yes.
And he's going to nod his head yes. Again, this would put my stroke patient at risk for pneumonia. It would also indicate that I need to further explore a swallow valve, probably a speech therapist. He's already having problems, I've noticed, with his slurred speech. Also, with swallowing that water, I observed him coughing a lot and struggling. So again, with stroke patients, the musculoskeletal system is going to be an important system to explore. So there's a couple tests I'm going to have my patient do. Some observations I'm going to make. For example, I want to assess the upper and lower extremities. Can you just sit on the side here? Yes. So I'm going to ask my patient to take my hands and then squeeze them as best he can. And I'll notice if there's any weakness on one particular side. A lot of times with strokes, one side is going to be weaker than the other. In this case, his right side was weaker, I noticed, than his left side. Also need to check the lower extremities. So what I would ask my patient to do, scoot farther back. If we can see his feet, I would ask him to push on my feet and then pull against my hands to see if there's any weakness there. Again, his right side appeared a little bit weaker than his left. I'd ask my patient, do you have any numbness or tingling?
Nope.
He's going to shake his head no. And then again with his toes, I'd ask if he can point them and then bring them back towards himself. I'm going to see if there's any kind of he can't dorsio plantar flex. So I'm thinking maybe if I do notice that, is foot drop going to be an issue with my patient, since the lower motor neurons are affected in stroke patients, which can result in that foot drop deficit, creating problems with his gait. So again, I looked for muscle strength, weakness on one particular side of the body. I'm going to have, at this time, my patient close his eyes, and I'm going to ask him to raise both of his hands, both of his arms, and his right side is going to be lower than his left side. Again, a lot of times with strokes, you know, with strokes, you ask them to close their eyes, lift their arms. One side will be lower than the other side. One arm tends to drift down. So hopefully we displayed that good enough. Also, when I look at the muscle system, I'm looking at if there's any atrophy on one side, you know, flaccid or spasticity on one side. Also, fine motor skills would be important to test at this point. So I'd ask my patient to take his left arm, and I want you to touch your nose. That was good. So then take your right arm and touch your nose. And you can see he misses his nose with that fine motor skill. I'm also going to test my patient's balance. So I'm going to ask you to stand, Mr. Larry. And what I would do is have him stand on one foot. And you're fine where you are. Yeah. So go ahead and stand on one foot. Okay. And then stand on the other foot. I would observe for any kind of balance loss in my stroke patient. At this time, I would also check my patient's gait. So I would have my patient just take a walk normal, as you normally would. And my patient is attempting to perform an ataxic gait, which is often common with the stroke patient. That's good. So that gait is a wide stance, uncoordinated. Again, looking for any foot drop, that would be the patient not heel striking. Their toes come down before that heel comes down. Oftentimes, patients who have foot drop are at increased risk for falls. They trip on their toes a lot. They need special orthotics to manage that foot drop. Also, I will check the deep tendon reflexes of my patient. So if I had a reflex hammer, I'm going to check the brachial reflexes here, check the patellar reflexes, and then we check the ankle reflexes back here. And those should all be at least +2. Those are normal reflexes. Absent reflexes definitely need more investigation. So moving on to the urinary system, with patients, there is a couple, with stroke patients, there's a couple things I'm looking at. And that is, do you have any symptoms, do you have any blood in your urine that you've noticed? Is it pink tinged? Also asking for if they had any increased volumes in urine. This might indicate, diabetes. It would be common with diuretics. Do you have any trouble with urinary incontinence?
Oh, not usually. Sometimes I feel like I can't get into the bathroom in enough time. I always use those urinal things you get at the hospital. Those have saved me quite a few times.
Okay, so I'm going to palpate. I'm going to do the gastrointestinal system. If my patient would just lay down on the bed, I'm going to palpate the 4 quadrants, see if the patient has any pain. He does not. Nope. I'll also listen to his vowel sounds in all 4 quadrants, make sure those are active, make sure nothing's going on there. Then you can sit up. I need to ask my patient about any signs of internal bleeding. So that would consist of asking my patient about any dark tarry stools that they notice when they have bowel movements. He's going to say no. Just moving on to assessing the skin in my stroke patient, I'm going to look for any signs of dehydration, any skin tinting that I notice. Maybe my patient's not able to have proper intake of water. I'm also going to assess my skin for my patient for any bruising. A lot of times stroke patients have the antiplatelets that can make them susceptible to bruising. Moving on to the symptom assessments part, I need to ask my patient, do you notice any facial drooping during the day? And does it resolve if you do have any? Do you notice on some days you have more difficulty swallowing solid foods?
No.
What about liquids? Do you notice what that, when you cough, you have trouble swallowing?
Yes, with liquids most of the time.
Does your speech become slurred more than usual?
It's consistent, but I wish it would get better.
Do you have trouble remembering the names of people or objects? Do you have trouble expressing words? And have you had any falls since your stroke?
Almost. I've had some close ones, but I use a walker. I really don't like it though.
Okay. So now let's sit down here and talk about some of the psychological, social, and spiritual pieces of information that can help further develop your post-stroke care plan.
Cool.
So I want to take a look at some psychological aspects of your life that can affect how you heal and manage as a stroke survivor. Do you believe it is possible to change?
Yeah, I have to. I need to change my lifestyle. I need to continue learning. They were really nice to me in the hospital. They inspire me to change what I'm doing. I don't have to be unhealthy, but little things can go a long way.
You sound like you have an optimistic outlook on your situation.
I'm trying. My kids and wife have been very supportive, so I'm lucky there. But it's going to be a long road. I've taken some absences from work, but I do have some disabilities right now.
Does that create a sense of loss to you?
Yeah, for sure. I've lost my independence. I can barely make it to the bathroom, and I'm not allowed to drive at all either.
Wow, losing your independence is tough. Based on your health assessment, I would like to refer you to our physical and occupational therapy departments who can help you develop skills and strength to find your independence again.
Oh, that would be awesome. Hoping someone could help me out with that.
Do you ever feel like you cannot express your fears or angers about your stroke?
I'll get down on myself for not treating myself better or paying attention to what doctors have told me before.
It's normal to feel anger or hurt. Our clinic has a tremendous support group of stroke survivors and community members. This could really benefit you and help you understand and work through those feelings. So another aspect of our overall health is to consider our spiritual health. I heard you talking about getting down on yourself for not treating your health as a priority. Do you feel that you can forgive yourself and move forward to heal?
I've asked myself that question. I think I can, but I just don't know about doing it on my own.
Sure. Has this experience caused you to grow spiritually?
Every day is a blessing to me. I don't let the little things go without taking them for granted.
That's a positive outlook. You have chosen to embrace life instead of giving up. Do you feel like you can embrace uncertainty?
Since I've had the stroke, everything has become uncertain.
Yeah, it must feel that way. Managing your stroke and making behavior changes may feel that way too. I ask that you keep your mind open and embrace uncertainty in order to receive information that can be valuable to your recovery.
Will do.
And lastly, let's talk about the social side to your health. Do you feel like you make time to connect with your family?
Oh yeah, they're very, very supportive. They give me lots of laughs.
That's great. Do you feel you have a sense of belonging to your community then?
My social goings have gone down a bit, but it's just not that fun anymore because I'm worried about being around other people that treat me differently. I used to go out with the guys and we would drink and eat Buffalo Wild Wings for hours, and now not so much.
Yeah, that can be difficult. You do not necessarily have to stop doing those kinds of things. You just need the tools to understand how to make the right choices and equipment to help you navigate while you work through some of your mobility deficits.
Oh, it made me happy to find out.
Do you participate in physical activity?
No, not really. I definitely need to do more.
That can be a goal to work on. Physical activity will begin to become a part of your lifestyle. It can also be a good way to make social connections through either groups you find yourself or through our community resources.
That's true. I never thought about physical activity as a social thing. It just seems like a lot of work. Like you have to sweat in order for it to do anything.
Well, we'll work this into your care plan and get you on the right physical activity program. You'll find that so that you can maintain it yourself. So this concludes our initial assessment. I want to send out some referrals, get you started on managing your health, and we'll continue to follow up with you and evaluate any ongoing needs you may have.
Sounds good.